Hi guys, you are watching my YouTube channel, Hidden Facts. This video is continuation of previous video which was Coronavirus a Complete Guide. This video is part 2. I recommend you to watch this video to its full length. Kindly like the video and subscribe the channel.
Who is at higher risk? Certain people are at a high risk for a serious infection if they catch COVID-19, the disease caused by the new coronavirus, including those over age 85 and people with heart disease, lung disease or diabetes. Older adults and COVID-19. According to the U.S. Centers for Disease Control and Prevention (CDC), 8 out of 10 deaths in the U.S. from the new coronavirus have been in people 65 and older. An estimated 6% to 29% of people 85 and older who get COVID-19 will require intensive care. Here are some reasons why older adults are more likely to have long-term health problems that can put them at risk. People's immune systems tend to weaken with age, making it more difficult for older people to fight off infections. Lung tissue becomes less elastic over time, making respiratory diseases like COVID-19 a particular concern for older people. Inflammation in older people can be more intense, causing organ damage. COVID-19 and heart disease. Although COVID-19 most often affects the airway and lungs, these organs work together with the heart to drive oxygen to the body's tissues. When the lungs are overtaxed due to illness, the heart has to work harder, which creates challenges for people who are already living with heart disease. The American Heart Association notes that viral illnesses similar to COVID-19 can raise the risk of a heart attack in people with a buildup of plaque in their blood vessels. Research shows that viral illness can make it more likely that a piece of the plaque lining the vessels could break off and block blood flow to the heart. Lung disease and COVID-19. Chronic airway and lung diseases such as chronic obstructive pulmonary disease or COPD, such as emphysema, asthma, pulmonary fibrosis and interstitial lung disease can set the stage for a more severe infection with the new coronavirus because of scarring, inflammation or lung damage. It's very important for people with these conditions to work with their doctors and ensure they have adequate supplies of maintenance and rescue medications on hand. Diabetes is a risk factor for COVID-19. People living with diabetes have an increased risk of getting very sick from the new coronavirus. Diabetes type 1 and type 2 both cause an increase in blood sugar. Poorly controlled blood sugar can make viral diseases, including COVID-19, more dangerous, possibly because higher blood sugar can create an environment where viruses are likely to thrive. In addition, diabetes increases inflammation and weakens the immune system, making it harder for people living with the condition to fight off disease in general. Those living with diabetes should adhere to their medication regimens and do everything possible to keep their blood sugar under control. Having an adequate supply of medications and staying in close touch with the doctor can add to peace of mind. Coronavirus prevention guidelines apply to everyone whether or not they are in a high-risk category. Everyone needs to take steps to protect themselves and others from catching or spreading COVID-19. Severe illness is occurring in people who have no known risk factors, including young adults and even children. Social distancing, frequent thorough handwashing and other guidelines are appropriate to help lower the risk for everyone, especially the most vulnerable. Caregiving for the elderly. When it comes to COVID-19, the disease caused by the new coronavirus, older people are especially vulnerable to severe illness. Research is showing that adults 60 and older, especially those with pre-existing medical conditions, especially heart disease, lung disease, diabetes or cancer, are more likely to have severe or even deadly coronavirus infection than other age groups. Keep yourself well first, and most important, as a caretaker you should take all the precautions you can to avoid becoming infected yourself. Here are the basics. Wash your hands frequently with soap and water for at least 20 seconds before and after providing care, preparing food, using the bathroom, or touching surfaces in public places. Avoid crowds, and if you cough or sneeze, do so into the bend of your elbow or into a disposable tissue. Keep your hands away from your face. Clean frequently touched surfaces in your home often, including mobility and medical equipment used by your loved one, such as walkers, canes and handrails. Practice social distance but not social isolation. One important way to lower the risk of your older family members catching COVID-19 is to limit in-person visits. But this may be tough for older adults who cherish time spent with friends and family members. Arbaje says, social distancing doesn't have to mean isolation or loneliness. We need to keep older adults safe, but also keep in mind that social isolation can have a negative impact on older people's immunity and mental health. She notes that in terms of social contacts, seniors should be encouraged to think beyond their usual circle of friends and family. Saying hello to the mail carrier or checking in on neighbors close by can add to a sense of connectedness, Arbaje says. With many houses of worship closing their doors until the pandemic eases, congregants, especially older ones, may feel cut off. Faith communities are often a big part of older adults' social lives, Arbaje says. Caregivers might help their loved one access online services and outreach for spiritual solace and support. Technology for staying connected to help older adults feel involved, purposeful and less lonely during the pandemic. Show them how to video chat with others using smartphones, laptops or tablets. Use apps on these devices to provide captions for adults with hearing challenges. Encourage friends and family outside of your household to telephone, write notes or send cards to lift your loved one's spirits. Keep elders involved. Researchers recommend giving homebound older adults a project they can work on. Think about going through and organizing old photos and memorabilia together, and enjoy the stories and happy memories they inspire. It can be a good time for an elder to demonstrate cooking a favorite family recipe or share favorite songs or movies with other people in the household. Minimize the risk of COVID-19 infection. Postpone unnecessary doctor visits. If an older adult in your care is feeling well, consider helping them postpone elective procedures, annual checkups and other non-essential doctor visits. Keep in mind that many older people, especially those living with chronic illness, have important relationships with their caregivers. To help them stay in touch, ask their doctor's offices if they offer telemedicine, which enables doctors and patients to communicate over video, email or other means rather than face-to-face. Avoid travel. Older adults should put off non-essential travel, particularly cruises or trips with itineraries that would expose them to crowds. Decide on a plan if you can. Involve your older family member in discussions of how you'll manage interruptions of routines and what will happen if they, or someone else in your family, become sick. Talking things through ahead of time as a family can reduce stress and help everyone feel more involved and prepared. Pick an emergency contact. If you're the main caregiver, designate someone nearby whom you could rely on to care for your elderly family member if you yourself become ill. Stock up. Gather 1 to 3 months of medications, and at least 2 weeks' worth of food, over-the-counter remedies, pet supplies, and other essentials. Find out which delivery services are available in your area. Symptoms or exposure. If you or your loved one learn that you might have been exposed to someone diagnosed with COVID-19, or if anyone in your household develops symptoms such as cough, fever or shortness of breath, call your family doctor, nurse helpline or urgent care facility.
Thank you for watching the video. Hope you get wonderful information about prevention from coronavirus. Goodbye and take care.